I am very honored to be invited to this extremely interesting meeting and to have an excuse, if an excuse is needed, to visit once again Venice, one of the most glorious cities in this most beautiful of countries. Okay, I feel obliged to, as the chairperson has said, to disclose that I have links to commercial organizations, some of which produce therapeutics which are mentioned in this presentation. I am going to be focusing my talk in my inexpert way related to informatics. I have to say I'm one of these people who, in terms of informatics, my knowledge is limited to being able to contact IT whenever I have a problem, which is frequent. And it is also relatively infrequent that they can solve it, but that's another point. But I'm going to focus on areas of medical treatment and therapeutics in which I have some experience. And I'm going to talk about rare chronic diseases. Some of aspects have already been mentioned this morning. These are lifelong serious illnesses. They are rare. They are not the focus of much attention from traditional big pharma, although this is changing very rapidly as reimbursement mechanisms make these actually quite lucrative, because these treatments are extremely expensive, and if you can generate a reimbursement pathway, there is a good road to good profit. These illnesses, particularly the ones which I am going to exemplify, have been traditionally extremely serious illnesses associated with large mortality and morbidity. However, there has been great progress in the past years. They are characterized by strong patient awareness and involvement and advocacy, and this is what most of my talk will be about, in relation to how patients have used the benefits of digitalization and information technology in overcoming the various hurdles posed by these illnesses, not the least of which is social isolation. And I will also exemplify this through the two diseases which mostly affect my area of activity, which are hemophilia and primary immune deficiencies. And since I am not certain as to the extent of your own knowledge on these disorders, which are, as I said, very rare and not very commonly, people are not very much aware of them, I will say very briefly something about each of them as I come to address the individual illnesses. Hemophilia is a disorder of what's called the blood coagulation mechanism. If you have this disease, when you have a relatively minor injury, the normal mechanism which causes the blood to clot and the blood loss to be stopped is defective or absent. It is a very famous disease for historical reasons. The British monarch Queen Victoria, the great-great-great-grandmother, I think, of the current incumbent, was what is called a carrier for this disease, because this disease is due to a gene which is found on the X chromosome being defective. So the disorder is transmitted by mothers to their sons. The most common manifestation of hemophilia is the bleeding into tissues and joints. And you can see in a somewhat dramatic form this shown in this slide over here. This is a picture of what hemophilia is like for the vast majority of patients in the world where treatment is not available. And this would have been the picture in our societies, in the Western wealthy economies, including Italy, up to about 40 years ago. If untreated, hemophilia leads to a short, pain-filled life, and the most famous hemophiliac in history is the Tsarevich Alexis, who was the son of the last Tsar of Russia. He was the great-grandson of Victoria, and he had hemophilia, and you know from your I guess, reading of popular history, how the monk Rasputin acquired influence in the Russian royal family through pretending to be able to treat this kid who had a very very, very bad life, like all patients like him. He probably lived a little longer before he was assassinated with his family because he had good overall care and protection. But he had a very bad life in terms of bleeding, and this is what made hemophilia more or less famous. As I said, these days, the bad pictures which you see down there on that slide are limited to the countries in the poor economies where treatment is not yet available for financial reasons and no other reason at all. Now, hemophilia, like most chronic illnesses, has patients who are very aware of their disease. They are, in most instances, much more expert in relation to what's wrong with them and how they need to treat it than most ordinary physicians. And they are organized globally in many patient groups which are more or less associated in a federation based, located in Canada for historical reasons which I won't go into, which is called the World Federation of Hemophilia. Hemophilia is big business, ladies and gentlemen, because of the fact that now what used to be a very bad thing to have is treatable to a level which allows normal life if you can get the money to treat it. It means that compassionate westernized economies like we fortunately live in this country reimburse hemophilia to the extent that the global market is $9 billion. So this is big money. This global market is a misnomer because, as I said, this is limited to the mostly westernized wealthy economies which can provide and generate through a good healthcare system treatment for the patients. Hemophilia in India, and we shall say something about hemophilia in India, hemophilia in China and most of the countries of the East and Africa is unfortunately totally untreated with the results which you can anticipate. I will now spend some time talking about how digitalization is contributing to the increased well-being and awareness associated with this disease. And I will mention some aspects of social media, all of which you are infinitely more familiar than I am. I will exemplify this mostly through Twitter type posts, but exemplify some others. And then I shall also speak about some treatment aids which are possible through digitalization, which have made life infinitely easier. So if we look at Twitter, I'm going to draw for the next 4 or 5 slides on a presentation based on a survey by the company Pharmac, which is actually based in India. If you try with the tag for hemophilia for Twitter, you will get quite a lot of hits on a daily basis. And you can see the results over here in terms of the numbers. And then you can classify these hits in relation to the kind of categories which you see over there. And these are patients. So these are the people who actually matter in relation to this disease. Further analysis of this data coming from the Twitter posts shows interesting results in terms of what concerns patients. In terms of, for example, if we categorize patient and social support, this is immensely important for a disease which is characterized by isolation and where not treated by immobility. It's obviously very helpful to have a motivational dimension and a motivational increase for carers and patients, especially in areas where digitalization, mobile phones, computers, and so on are available, but unfortunately the treatment is not. Fundraising is also extremely important and can be used through social media to enhance publicity and so on, and also awareness in relation to research. Moving further, the questions of expression, empathy, and sharing. And here we start going into the concerns of the families. Very interesting and quite moving types of posts, especially in relation to the fact that there is full awareness of the genetic inheritance of the disease, the role of mothers. I'll show you something more about mothers in a second, but the extremely, I think, emotionally charged situation for mothers who know that they have passed on the disease to their sons, and what is going to happen if I'm going to have another baby, especially in cultural areas where there is an expectation that families increase and that more sons will come along. In terms of knowledge and so on, very important in terms of expressing and giving information about areas of potential care which are not necessarily linked to the very expensive treatments, but linked to things like advice in terms of emotional well-being coming from exercise, coming from yoga, good nutrition, the application of ice when one has a bleed, and so on and so forth. And always the question of awareness, especially, as I said, in the areas of the world where awareness is needed because it is not a disease which is socially very visible. I will try not to take up too much time on specific areas anymore, but summarize this as saying that this gives us the capacity to generate a social essence, which can be seen from these Twitter posts, but can also be seen from the other types of social media in relation to what are the issues which are most important to patients, issues which, as I said, are mostly important in areas where there is insufficient medical infrastructure and care, as there are in countries such as Italy, but where the ability for patients to share experiences between themselves and their families becomes infinitely more important. Well, everybody has Facebook. I was just discussing this with my partner, that probably people in our age group have more interest in Facebook than young people, but Facebook in hemophilia is also very important. This is a Facebook page of the youth group of the Hemophilia Federation in India. Obviously, India, a country of 1 billion people, has a lot of people with hemophilia. Most of them are undiagnosed, and most of them die before they can be diagnosed because there is inadequate treatment. But the social media, including Facebook, is very important for them. You can see here the publicity regarding workshops on advocacy, something very important for patient groups. And this is now an example of a blog of a mother with hemophilia. This is from the environment in the United States in which she is explaining her activities and her connections in relation to the National Hemophilia Foundation in the United States, and explaining the day-to-day experiences which she has within her family in the context of her child with hemophilia. Going back to India now and getting into another aspect of social media, this is the Hemophilia Foundation of India's WhatsApp group. And it's quite interesting to see the use, the reasonably, I would say, innovative use of the patients with this app. If you look, for example, at elections for the patient association, these are a couple of extracts from recent types of activities, 2 different patients putting themselves forward as candidates for the positions within the Hemophilia Foundation of India. I think this is extremely healthy to see the patients being able to take some level of autonomy and get themselves into positions where they can contribute further and compete actively for these kinds of positions, and putting forward, in the case of these patients here, their previous activities. One would wonder if these patients survive, whether in the fullness of time they will be running for public office in higher environments in their respective countries. So, as I said, therefore, this is the spectrum of activities relating to social media, and in this instance hemophilia, and I think you can see the benefits which can arise with appropriate availability of the technology. I would like to emphasize a point which is somewhat worrisome, which is that despite these benefits and despite all the benefits of telemedicine, even in our environments, none of this is by any means an adequate substitute for mainstream medical care. Basically, we treat hemophilia through expensive products resulting from a very profitable pharma industry, and this is what is needed, more access to the products. But the availability of social media facilitates this. I'll say something quickly now about applications related to treatment. This is the app of the Australian Bleeding Disorders Registry, which you can download onto your mobile phone. And this is an extremely important application because it allows the monitoring and registration of treatment. So all patients are provided with this application, and here is the various components of the app, and you can see that you can input into the app. In fact, it's not a question of can, you must. If you are to be registered on the Australian Blood Donor Bleeding Disorders Registry and access treatment, you have to take the app and you have to input your treatment. Australia is a very wealthy country. It is extremely generous to people with hemophilia, but they, on their part, have obligations in making sure that the treatment is monitored and that there is the ability to analyze patterns of care. And these are the kinds of data which patients themselves, in this instance it is my own app, have the obligation to input into their treatment patterns. And this is immensely important because it is then linked, again through digitalization, to the Australian Bleeding Disorders Register, which allows then centralized collation and analysis of the data by the health authorities in order to assess the efficacy of treatment, plan for supply, and all the other things which are immensely important. So I've mentioned registries, and the patient organizations themselves recognize the importance of registries, and this is the guideline developed by the World Federation of Hemophilia to developing a national patient registry. This is something immensely important, especially when you deal with such a rare disease. The only way in which you can actually generate information for something which is epidemiologically practically invisible to normal healthcare procedures is to have this kind of registry linked to specialist or patient input. And again, this facilitates monitoring and planning, and you can see on this slide the kind of data which is able to be generated, in this instance again by my own country's registry in Australia, in relation to the different types of bleeding disorders, the treatment patterns, the planned versus actual product usage in this instance. Very important when you're dealing with a disorder which costs many hundreds of millions of dollars. And on the question of cost, I'm intrigued, and I share with you this other aspect of digitalization, of good use of informatics. In this instance, in the United Kingdom, like Australia, a social market economy, extremely generous to hemophilia, but like Australia as well, extremely anxious to make sure it minimizes and makes more efficient healthcare spending. And this is the use of an e-auction. This is kind of like eBay, but in this instance, the vendor is the actual United Kingdom government, who is attempting through competition generated through electronic auctions to procure the lowest possible price amongst the various products allowed to compete on the basis of quality, safety, and their capacity to treat the disease. So I won't go into detail here, but what you're seeing here is the actual time course of the auction, and you can see how remarkable it is that expensive products drop in price over the course of the auction as the competition comes up, and extracted from the paper is the really important information that this kind of mechanism results in an annual saving to the National Health Service in the United Kingdom of £42 million without decreasing any level of care and without unnecessarily causing patients to shift their products. These are all issues which are immensely interesting to us who work in this industry and deserve the discussion in their own right, but we don't have the time. Enough on hemophilia. Another group of disorders less advanced in treatment are the primary immune deficiencies. These are diseases in which, like with hemophilia, lack of a protein in the blood causes a pathology. In this instance, it is the lack of the capacity to synthesize immunoglobulin, or antibodies, as most people call them, which are immensely important, of course, in fighting infection. And you can see here the Facebook page of one of the patient organizations, based in the United States, the Jeffrey Modell Foundation. Jeffrey Modell was a patient with PID, with primary deficiency, who unfortunately died, and his parents established a foundation in his memory, which they used to raise funds. They have generated, for example, this extremely important algorithm, the 10 warning signs of primary deficiency. It's nowhere as easy as in hemophilia. Hemophilia, if you see a baby with bruises, if you see a baby, bleeding without expectation, that's something to be very suspicious. But with immune deficiency, the spectrum of visible disease is much more complicated. So it's very useful to have this kind of tool. The World Federation of Hemophilia equivalent for the global primary immune deficiency community is IPOPI, the International Patient Organization for Primary Immune Deficiencies. They have various digital and electronic tools which are reasonably analogous to the hemophilia situation, somewhat less advanced. So I won't go into too much detail there, but you can see, for example, this is the Immune Deficiency Foundation of the United States, of patients again in the United States, with the development of webinars in order to give awareness, increase knowledge. The United States healthcare system is complex, some people would argue inefficient, but the question of insurance and reimbursement is infinitely more close directly to the patients than it is for most patients in the social market economies of the European Union. So awareness on how to actually get yourself insured and the treatment reimbursed is of key importance to the patients. And here are some more samples of the various social media posts, both for Facebook and Twitter, available in the Immune Deficiency Foundation's website. The industry, of course, since it makes so much money out of these disorders, provides itself a large amount of educational material through webinars and similar mechanisms. This is just one example. These are immensely useful. I myself, as I said in the beginning, I'm associated with the industry. I think it's a very good thing to have these available with the resources of industry. They are much more easily available than for the sometimes impoverished patient groups, but one has always got to filter the content of these, of course, in relation to industry interests. As I have indicated, it is very important that we have the capacity through informatics, through digitalization, to have good registries of patients. And in this continent of Europe, we have the so-called ESID, the European Society for Immune Deficiencies. If I wasn't here in Venice today, I would be in an equally lovely city in Barcelona, attending the annual congress of this society. And this registry is inputting data, is collating data from relevant clinical centers throughout all of Europe in order to generate the capacity to get a good idea of key issues such as disease prevalence, treatment patterns, and so on, which are extremely necessary and which, in the case of this group of disorders, primary immune deficiencies, are much less clear than our understanding of hemophilia. And this is just a sample from this kind of registries. Here you can see the registries from France and the UK, and these are individually generated in their own national environments, but they are also collated in the ESID registry, and these are just simple empirical data sets involving the relative incidence of the various different types of diseases in the different countries. And there are differences in this kind of epidemiology which are of immense scientific and ultimately public health and therapeutic interest. So I don't know if I'm on time. Oh, I've got nearly 2 minutes left, so I'm good. So I will just round off with some final reflections. I never have the final slide in my talk entitled conclusions. I have learned that there's no such thing. I think that it's clear that digitalization has enabled and enhanced many aspects of care for the patients in our communities. One of the most important aspects is the facilitation of communication between patients themselves and also between patients and stakeholders. This has expanded greatly the capacity for advocacy. For example, the Hemophilia Foundation of India, through a campaign early this year involving mostly social media, managed to modify a proposed law which threatened to limit even further patient access to treatment in the subcontinent in ways which I don't have time to describe, but it was very encouraging to see the way in which the patients were able to communicate with each other and with the relevant stakeholders, particularly the government, in relation to this. Wouldn't have been possible without Facebook and Twitter. Personalization of medicine today, well, we've already heard about precision medicine, and I reserve any comments in relation to the ultimate possible outcomes of this, but certainly in these diseases we are aware that there are big differences in patient phenotype. As to how much these are related to knowledge of genotype is debatable because we do not understand much of the human genomic basis for many of these disorders. And I suspect it will take a long time before we do, but we can personalize through phenotype, and this requires recording, monitoring, assessing continuously the interventions on an individual basis. This hinges a lot on the kind of applications which I have shown you before. We can also see, as I said, with the example of the United Kingdom, the use of these electronic tools to assist procurement, supply, and conserve the ever-shrinking healthcare dollar. We can improve educational aspects. We have involvement by non-commercial organizations and governments, but it is insufficient. Governments seem to be always too poor to balance the huge investment which industry makes in this kind of endeavor, and I would like myself to see governments and the relevant funders in the social market economies be more proactive. I emphasize what I said before as my concluding remark. We are very happy to have these tools. We're very happy to have digitalization. Well done, the people who understand these things infinitely more than me, but I would not like to see them viewed as being a relatively inexpensive substitute for very expensive medical care. Thank you for your attention.